As you should be aware now, the Trust in all the adult areas switched over to using the News 2 forms earlier this year in a rolling rollout. The way that the News 2 form is used is extremely important to track any deterioration of a patient's physical health, so this can be highlighted early and the patient routed to the most appropriate area of care. When filling out the form, it's important to go through it logically and to fill it out clearly and to make sure that all of the boxes are filled. If there is a gap, this needs to be documented as to why there is a gap. For one area that is new is with regards to the oxygen saturations. This is due to allowances being made for people who have COPD and are oxygen retainers. So in this box you have scale 1 or scale 2. Scale 2 is only for use when documented by one of the medics to do so, and is for people who have COPD but also retain oxygen and are therefore managed at lower levels of oxygen. Everybody else, including other COPD patients, is managed on scale 1. The scale that you are not using should be crossed out on the form. I will now talk you through filling out the News 2 form. The first thing that you must do when you start a new form is put the patient's full name, including any initials, in. It's then very important that you put in the NHS number of the patient. Then we need to decide how often we are going to do the physical health observations, so therefore we record a frequency of observations. In this case, this will be OD or once daily. We then, at the beginning of the form, we put in the baseline observation, and this will be done on admission or as soon after as we can when the patient is settled enough to do so. We input the date and the time. We then start looking at the respiratory rate of the patient, and we record where this comes to in the line. In this case, the respiratory rate is 19, so I'll put the dot in the middle of the 18 to 20 bracket. We then have to decide which scale with regards to the oxygen levels the patient is on. Are they on scale 1 for people with no COPD, or are they on scale 2, which some people with COPD would be on? In this case, the patient has no history of COPD or being of any degree. So we cross out the box that we would use if this was the case. We'll then look and we take their oxygen levels, which in this case are 98%, which puts us in a good category. Moving on down, we look at are they on air or oxygen, and if they were on oxygen, for example, a 15-litre non-rebreathe mask, then we would put it in this box here. However, they're not on anything at the moment, so we just put air. Moving down, we record their blood pressure. We use this doing V's and inverted V's and dashes, but we can write the number afterwards. In this case, the blood pressure is 142 over 84. So I can write above this, but not going into the next column, the blood pressure. We then record the pulse, which in this case was 98. Again, we can write this above. It's worth noting as we've done this that this is in the 1 category. We then move down to conscious level. Anything other than alert automatically scores a 3. The last box we will do is for temperature, and in this case the temperature of the patient was 37.1. Again, we can write above this. So going down and looking in the coloured boxes, we can see that we have a total News 2 score of 1. Purely the pulse has scored, so that's 1 in there. The review for a score of 1 is now for them to be reviewed, for discussed with the nurse in charge and reviewed within 1 hour. So escalation of care, yes, I've escalated it just to the nurse in charge and my initials. As can be seen when looking at the form, the News 2 form does not document the capillary refill time or blood glucose measurement. As these are not done routinely on this form, there is a separate trust approved blood glucose form that must be used where a patient is a known diabetic. However, if a patient is seriously unwell, we would still use a capillary refill time and a blood glucose measurement to inform our judgment making, and this would be documented on the SBARD form that we use when we are transferring a patient to hospital. With the News 2 form, the way that we do the escalation has slightly changed. Previously, if a score was changed by 3 or more, we would call an ambulance. Now, what we do is we look at the score and we see where the total score comes into, and we then use our judgment. If we are concerned, we would increase the escalation category by 1 category. So if it was a medium risk to the score, but we had staff concerns, we would increase to a high risk.